In our VR research study, we are working with people who have phantom limb pain, and that's pain in a limb that is no longer there after an amputation. So what we do here is we give them a virtual limb that is non-painful. We go through some visualization exercises, tell them to really picture this as their actual limb, and then have them do just usual activities of daily living in a safe environment.
So for example, if they have trouble using their right arm, then I'll try to have them focus on their right arm and work on some things that they wouldn't usually be able to do.
So Bradley's kind of like a coach for them. When they're in the environment, just work them through some different exercises that they do, be it washing dishes, or even just visualizing their hands opening and closing, telling themselves, this is my hand, it's not painful, it's a safe environment, and going through that with repetition over and over. So this is your hand that doesn't have a lot of problems. You're putting it in front of the mirror. The thought that we base this off of is mirror therapy, and that's where you visualize your normal hand as your affected hand. So we kind of took that concept, put it into virtual reality, and said, let's make this even more immersive and engaging. And we've had some really good results. Some people do quite well with it. They may be having a bad day, but they get into VR and they will almost always tell me that while they're in VR, they don't notice any pain. Afterwards, they often still notice some pain, but it's usually diminished from when they came in.
Medicine's always changing. Every year there's something new that comes out. Using VR, it's a different alternative to other therapies or modalities that patients use. Especially, we get a lot of patients who try XYZ medication with all these side effects. So this is a nice alternative to it.
VR has been around for a long time, but only over the last probably 3 to 4 years has the technology costs dropped to a point where just an average clinic or even patients could afford it. So I think virtual reality is like an exciting, promising frontier for medicine. No one really knows at this point exactly how VR can offer pain relief and how it can change the brain. We just know that in some cases it works really well. So a lot of areas to definitely study and look into in the future.